Sudden infant death syndrome, or SIDS, is also commonly known as cot death, and is the sudden unexpected death of a seemingly healthy infant. The chances of your baby succumbing to SIDS is very small, about 1 in every 2,000. This figure may seem frightening, but because parents are taking steps to avoid SIDS, there has been a 71% decrease in the UK of SIDS deaths since 1991. There is no single known cause of SIDS, but there are certain factors which make the risk higher. Babies whose mothers smoked during pregnancy and postnatally had an increased risk of SIDS, as well as babies who were born to mothers who received poor antenatal care. Premature and low-weight babies are also at a slightly higher risk of SIDS. SIDS is most common in babies between the ages of 2 weeks and a year, but the peak age is between 2 and 4 months. In rare cases, SIDS can occur between 12 and 24 months. The good news is there are lots of ways you can help to reduce the risk for your baby. Always put your baby to sleep on his back, never on his front. If you have an older baby who is able to turn in his sleep, place him on his back and let him find a position which is comfortable for him. Place your baby with his feet at the foot of the cot when you are putting him to sleep, so he cannot slip down underneath the covers, and tuck his sheet or blanket in at the sides so he cannot move around too much. Use a firm, dry mattress and tightly fitted sheets for the cot. Remove all baby's toys, pillows, loose bedding, sheepskins and cot bumpers. Don't let your baby overheat. Don't dress him too warmly or put his hat on his head when he's inside the house. The ideal room temperature is between 16 to 20 degrees Celsius. Don't overload your baby with blankets and sheets. Use our guide for what bedding to use, or use a special baby sleeping bag, which can control your baby's temperature and stop him from slipping under the covers. Put your baby's cot in your room for the first 6 months. Never put a hot water bottle or electric blanket in your baby's cot. Never smoke or let anyone smoke in the same house as your baby. Even going to a different room to smoke does little to reduce the exposure to cigarette smoke toxins. Don't add more covers to your baby's cot if he is unwell or has a temperature. Instead, swap his blanket for a sheet and remove some of his clothes so he does not overheat. For more information, see the Gurgle website.